So good evening. I'm David Levine. I'm co-chair of Science Writers in New York. My other co-chair is Joe Bonner, and he's actually behind the camera, making sure this works and making sure this is going to be uploaded to YouTube. My guest tonight is a great New York Times reporter, Apoorva Mandavilli. I hope I'm pronouncing your name right. Her writing focuses on science and global health. She is the 2019 winner of the Victor Cohen Prize for Excellence in Medical Science Reporting. And she's the founding editor-in-chief for Spectrum, an award-winning news site in autism science that grew an audience of millions. She led the team for 13 years and joined the Times in May 2020. Apoorva, do you want to join us?
Hello.
Thank you for being here. Sorry.
My pleasure.
So when did you start reporting on COVID?
Just about as soon as COVID started. I was at a holiday party for the Times Science Desk in January when COVID was still really new, and COVID didn't even have a name really at that point. It was still just a coronavirus that was causing some trouble. And we were just talking about various possibilities, whether it was going to be a pandemic, whether it wasn't. And I pitched a story about how kids didn't seem like they were really affected because already there was some evidence about that. And I had reported on SARS and MERS, so I knew that those were similar in terms of not affecting kids. And so I pitched that like over drinks, at this party. And then I wrote that story, but I didn't end up writing it until the end of January. And then we published it, I think, in early February. So from there on, I wrote a bunch as a freelancer while I was still at Spectrum. And I was writing more and more as the pandemic went on because it was clear that it was a really big deal.
So you went on staff in May of 2020.
Right.
Okay. You're on the front page almost every day with some COVID story you're writing or writing with a colleague. So.
Well, not the front page of the paper.
Sometimes.
Sometimes on the front page of the paper.
Okay.
But yeah, I mean, COVID is a big story now. And in a way, it's really a moment, I think, for science reporters. This is our time because there are a lot of reporters at the paper and everywhere else writing about COVID, but we're the ones who can actually understand a lot of this stuff. So it's a great time, I think, where people are really recognizing that being a science journalist is a cool thing and that we have some expertise to offer.
Okay, so why don't you tell us a little bit about Spectrum, because not everyone knows about it. I do. I've written for the Simons Foundation.
Sure. So Spectrum is a website about autism science, and it is designed mostly for scientists. It's actually primarily intended for scientists. I was recruited while I was still at Nature to start this website, and it was intended to be initially just for grantees of the Simons Foundation, but I had a much grander vision for it. So it's actually a news site for any scientist who's interested in autism, but over time, it's also grown to be something that is of interest to anybody who wants to learn about autism. And that includes, people who have autism themselves, families, and anybody with a casual interest. So that's what Spectrum is. It's sort of they cover research news about autism and, long form pieces that are beautifully told. There's a podcast. It's a news magazine.
Okay, so for those who are joining us, and it's growing, as I speak. If you have a Q&A, we have a Q&A box at the bottom of the screen, and that's where I would like you to put questions, and then I will read them. So I'm going to start with a few questions that were submitted by our readers. People who registered in advance. We always say, if you register in advance, please join us. So here's a question. How do you find out about the current levels of adverse events with the vaccines?
There are a lot of different systems that the FDA is using. There's one that's always been in place. It's called VAERS. It's a vaccine adverse event reporting system. There's also an app that the FDA created just for this vaccine. It's called vSafe, and it encourages everybody who's had a vaccine to sign up and report any side effects. For example, there are about 20,000 pregnant women who've received the vaccine who are in the vSafe system. And it's a very easy way for the FDA to sort of keep track of any side effects that arise in those women. And then, they're also really monitoring any reports that come through doctors and any healthcare providers. So there are multiple ways. I mean, I would venture to say this is probably the most closely watched vaccine that we've ever had.
Okay. And someone says, what have you learned about current levels of adverse effects from the vaccines? Which ones have occurred and how frequently and how often?
We've had about 40 million people vaccinated so far, and there is no side effect beyond, sort of fever and body ache that has shown up in more than, say, 40 people. So it's very, very small numbers. The most scary thing I've heard about is this sort of microclotting disorder where basically some number of people, I think it's about 36 now, seem to have developed a condition where they have no platelets and they just don't have any clotting at all, which is really just scary. And that, I think it's still very, very small numbers. It's extremely rare if you think about it. 36, so let's say 40 out of 40 million. So the side effects are pretty far and few and far in between.
That's good to know. Someone says, do you know enough to comment on the SARS vaccines being developed in Cuba? I understand there are 4 different ones in various stages of testing. So
I do not. Yeah, I don't know enough about those vaccines to be able to. Okay. I don't think there's enough data out for anybody to really be able to say how good they are.
I didn't even know there was a Cuban vaccine until I had a panel of Latin American journalists who said, oh yeah, they have it. So, okay, so again, for the audience, because more people are joining us, it takes a little while to get in. Also, we had some breaking news at 6:30 on the Nora O'Donnell saying that the CDC now advises people to wear 2 masks. So what's the breaking? Is that at all times? And what kind of masks do you have to wear?
So you could wear either a surgical mask that is really sort of tightly fitted to your face. Surgical masks are really quite good. It's just that when most people wear them, they gape on the sides, and so
are those they're the blue ones, right?
Those are the blue ones, exactly. And they're easily available now, although at one point they were worried about them being in short supply. So if you wear those, it's really more about, you can wear just one, but just make sure that they're really well fitted, or you can wear a surgical mask and wear a cloth mask on top as a second layer to, again, just make sure that there isn't a lot of air getting around through the sides. That's it. So the reason they're recommending that is because we have these more contagious variants now. And the more contagious variants are just much more efficient at infecting people. And so anything that we were doing before, we just have to do even better, even more efficiently, even more rigorously.
At the same time, they showed a graph that the hospitalizations are going down across the country and the number of cases are going down. And what do you attribute that to?
That's a really good question. I mean, we haven't seen this kind of dip really since the beginning of the pandemic. We've seen little dips here and there, but for the most part, we've been on kind of a steady sort of incline for most of the pandemic. So it's been pretty cool to see this drop. There are, I think, a number of things that could be happening. One is that we actually had a lot of cases because of the holidays, Thanksgiving and Christmas, the winter holidays. And it's possible that right after those holidays, people are just hunkering down for the winter and not really seeing each other. And so that's one possibility. The other is that because of all the coverage about variants, people are actually a little scared and trying to be more careful themselves. And also the third thing is that some states have been more careful. They've put in some precautions. For example, Rhode Island around the holidays put in what it calls a pause, which is a partial sort of lockdown. And a lot of states did things like that in response to the rising numbers. And so I think it could be a confluence of all three. But I will say that we are expecting the variant that was circulating in the UK to take off here and be the predominant form of the virus by the end of March. So I wouldn't celebrate these low numbers too much. I think they're going to go back up.
So as a New Yorker like myself, indoor dining is opening on Friday. What do you think about that?
I think it's terrible.
Okay.
I think indoor dining is extremely foolish when we are looking at a new variant that is this contagious. I think any indoor space is inherently risky because we know now that the virus actually thrives in these small indoor spaces with poor ventilation. So if there's a restaurant that has its doors and windows open or has amazing ventilation systems, HVAC systems set up, sure. But that's not the case for most restaurants. So unless it's outdoor dining, I would skip the indoor dining.
Well, outdoor dining is not easy one. It's going to be 28 degrees this weekend. So it's not so much fun.
Do takeout.
Do takeout. Yeah, okay.
I think that's a good way to support restaurants and, you know, not have it be risky. And it's also safer, honestly, for the people who work there.
Okay. Okay, so we're getting questions. Good. What have you found most challenging as a science journalist covering this pandemic?
The pace.
Okay.
There are more stories than I could tell, even if I worked around the clock. And some days it feels like I am. I'm not, but it feels that way. The treadmill is just very, very fast. At any given time, I'm working on, you know, a dozen stories, and there still just never seems to be enough time to get to everything. So that's probably, for me, the biggest challenge.
Okay, so here's much of the reporting is coming from non-peer-reviewed papers. So those are the early prints which have not been gone through the whole peer review process. How do you adequately vet these preprints to ensure you're not reporting on scientifically questionable studies?
I do my own sort of peer review, which obviously is not going to be as rigorous as a peer review that, you know, that scientists would do if this was submitted for publication. But what I try to do is just have, you know, a bunch of scientists that I really trust. First of all, even before I cover a preprint, I send it out to a bunch of people to vet. And then once I've made the decision to cover it, I really try to get to every aspect of the preprint with an expert and really have it evaluated so that it's only being covered if it's excellent. So, you know, at the beginning of the pandemic, we were much more lax with preprints. Before the pandemic, I never used to cover them at all. I had a rule not to. But of course, in the pandemic, that just rule had to fly out the window. It just was impossible not to cover them because there wasn't enough time for most things to get peer reviewed. And even now there often isn't. So, you know, it's just not the kind of thing where we can wait. It's a very urgent situation. So I'm just trying to be extremely careful with what I cover and how I cover it.
Okay. So this is from Lydia Denworth, and I mentioned her name because I've interviewed her in person. We used to do these in person about her book on friendship. She wants to know what interests you most right now in this ongoing story.
I'm really anxious and also intellectually curious to see what happens with the variants. I think the virus has evolved a lot more than any of us expected it to. A lot of scientists that I speak to on a regular basis were really surprised to see these variants come up as fast as they have. Coronaviruses mutate generally much slower than a lot of other viruses, including the flu. So they were expecting it to mutate because viruses do, but they weren't expecting it to gain mutations that affected vaccine efficacy in any significant way, quite the way that it has. So that's been pretty scary, but also very interesting to watch.
So South Africa announced they're stopping to giving the AstraZeneca vaccine because it's not effective against the South African variant. So do you think that will affect the approval in the United States?
I don't see why it would affect approval here because we only have a couple of cases of the variant so far. And it has not taken off and it may not. I mean, it's of the variants that are out there, that and the one in Brazil are probably the most forbidding in terms of the vaccine issues, but doesn't mean that they are going to be the ones that are the most dominant forms. I think the one in Britain is the one that has already kind of found a foothold here and will probably spread the most. So, and vaccines work fine against that. So honestly, I don't see it affecting approvals here in the short term.
Is it still easy for you to find sources for your stories, or has it become more difficult as sources grow fatigued of media interviews? Well, you're calling from the New York Times, so people are always going to take your call, I guess.
Yeah, I have not had a problem with finding sources. And I think I was also lucky because I've been reporting on it for the whole year. I have a lot of sources now that I can just text and ask if I can talk to them for 5 minutes. So.
Okay. I do too. It's good to have that. Is it true that India has seen a reduction in the number of COVID cases? If so, then do you think that the hot and humid weather in India has a role to play in this reduction?
I'm sorry, what was the second part of the question?
The person wants to know whether the hot and humid weather in India has a role to play in this reduction.
Well, it's only February. It's not hot and humid there yet. Doesn't really start until late February, March, so I'm not sure that's the reason. I do think that the virus is seasonal. I think there is definitely a pattern to its rise and fall, but India is not quite in its summer yet, so I'm not sure that's the reason there. I think there's a lot of speculation about why. There are a whole bunch of papers that have been coming out about serology in various parts of India, in Delhi, in Mumbai, in various other states, and what they're suggesting is that there are a significant number of people who've already been exposed to the virus and just haven't gotten super sick and haven't died. It's kind of an enduring mystery why that is, but what they're suggesting is that India may not be at herd immunity, but that there are enough people who have been infected that the virus is sort of slowed down.
So how do we introduce you to other scientists to consider speaking with on a recurring basis? How do I introduce you to other scientists whom you will consider speaking with on a recurring basis? I guess a news source.
I guess email me with their expertise and I will look at them and see if they make sense for any story. And then depending on how that goes, they may become a recurring source. I'm not really sure how to answer this question.
Okay, but I guess they're basically asking, are you reachable?
I'm reachable. I'm so reachable. Yeah, you can DM me on Twitter. My Twitter DMs are open to people that I don't follow. And my email is apoorva@nytimes.com. I am very reachable.
Yes, I reached you. Yeah. If there is a vaccine that directly stops one or all the current variants, will revaccination be the acceptable practice?
If there isn't a vaccine that blocks it?
If there is a vaccine that directly stops one or all the current variants, will revaccination be the acceptable practice?
I'm thinking that they probably meant to say it the other way. If there is a vaccine that works against everything, then we don't need to revaccinate. If there isn't one that works against all of them, then yes, we will need to probably tweak the current vaccines to work for that other variant. So what is under discussion is possibly a booster that would be specific to that new variant. And the FDA is actually in the process of coming up with some plans. So they said last week that they will roll out some suggested plans for how that would work, what the companies would need to do, what the approval process would look like, what they would actually do in terms of vaccinating people. And then they're going to open it up for comments from scientists and then decide what they want to do. So they're thinking ahead, which is good. So far, it doesn't seem like we really need it because the vaccines that we have are working against everything out there, including the one in South Africa, which is, as I said, the scariest one. But even that one The vaccines are a little bit less effective, but the vaccines are so good, so much better than we need them to be, that they do really work even against that one. I know there's some data that came out about AstraZeneca over the weekend saying maybe that doesn't work so well in terms of mild and moderate disease from the South African variant, but that is, first of all, it's preliminary. It was only done in young people that, and who don't tend to have severe disease. And the numbers were really small. So I would not lose any sleep yet over those results.
Well, I mean, every day it's different. Like some people say, well, yes, you're supposed to get it 3 or 4 weeks, but maybe it's better to get it, to wait for the second one. That seems to be effective for some people. So, but nobody really knows. For sure.
Well, we know that it works pretty well even after 3 or 4 weeks. We know that from the clinical trials. So I think that the FDA's stance of this is what we know, and we know it works well, so let's do that. I don't think that's actually a bad strategy right now. I don't think now is the time to experiment wildly with things we don't actually know work.
Okay. So as a reporter, you're used to being out interviewing people in person. So you're not doing that anymore, I guess.
No, and it's really sad.
Or being with colleagues or being in a newsroom.
Yeah, I mean, I basically started a new job with 1,000 new colleagues, and I have not met most of them. I've gotten to know a lot of them over the last year, thank God for Slack. But I've done video calls and phone calls and all kinds of things, and I've met some of them in person. Just Brooklyn, we could go on walks with colleagues and things like that. Okay. But yeah, no, it's I really miss reporting in person because it's just not the same as talking to somebody on the phone or doing Zoom calls. I just did a story about Rhode Island and what went wrong in Rhode Island. And it's exactly the kind of story for which I would normally want a lot of on the ground reporting. And I actually went to Rhode Island, and I was supposed to be at this hospital, and the hospital had crazy rules. So I couldn't get into the hospital, and I couldn't meet any of the people that I wanted to talk to, even though I had all the equipment and I was ready to go. They were too nervous. So yeah, it's not great. And I really look forward to the day when enough of us are vaccinated and I'm vaccinated so that I can do some on the ground reporting.
So we have a nice audience. They're concerned about you. How have you managed your stress levels during the pandemic, especially doing so much reporting on it?
Thank you for that concern. That's really sweet. As David can tell you, I was scarfing down some dinner right before this, and I had a very, very intense day today, but not every day is like that. How do I manage my stress levels? Well, I have 2 kids, and every day when I'm done working, I, normally at this hour, for example, I would be watching TV with them. They make me watch terrible cartoons that I have zero interest in. And then I usually read to them, and then they go to bed, and then I do a little bit more work. So it's not like I'm just working around the clock. It does get stressful sometimes, but I have an amazing, wonderful editor who's a lovely human being, and he makes sure that I take breaks, and he tells me all the time, take it easy, don't kill yourself, wait to file that story. So I push myself as much as I want to push myself, and I stop when I want to.
Okay. So I have a daughter who has a 3-year-old and a 1-year-old at home. And I made this mistake of saying, oh, it's so nice. It must be great to have all this family bonding. And she said to me, are you kidding? I trade places with you in a second. So she said, I want my babysitter back. I want my kids at school, my husband at work. So I realized, pretty early, it's not.
Yeah, I mean, you'll notice my door is locked behind me.
I see that. Yes.
Otherwise, there would be kids barging in here asking me very important, urgent questions about something.
Yes. What is your advice to a freelance journalist working during the pandemic? How can we get work?
I'm sorry, but I'm really the wrong person to ask that question because I have not really been a full-time freelancer ever. I'm pretty wimpy about that stuff, and I really like stability and security in an office. So I've never done it. I was a freelancer for the Times for a couple of years before, but I did it with the security of a full-time job. So it wasn't pitching as much as probably regular freelancers would be. but I guess I can tell you what worked for me with that is really knowing what my expertise was, really knowing what I can offer that nobody else on their team could. And in my case, that was, a lot of infectious disease stories that were just flying under their radar. But I would say, figure out what your niche is that is not being covered already for whatever magazine or newspaper you are pitching to, and convince them that A, it's the story that they really need to tell, and B, you're the right person to tell it.
So there's one more question about journalism. What are some of the key things you learned about the practice of science journalism while reporting on the pandemic? Has it changed how you report at all?
I think some of the logistics of reporting have changed. I don't think any of the principles have changed. I think, if anything, the principles of journalism for me have become really entrenched during this pandemic, like, holding people in power accountable, telling the truth with all of its nuance, making sure that people understand that science is an iterative process, that there isn't a conclusive answer halfway through. Those are all things that I think all of us try to do as journalists, and none of that has changed. It's become more important during this pandemic, but I don't think it's fundamentally changed. In terms of logistics, I would say the biggest change is how much time I spend on Twitter. I used to almost never be on Twitter, and now I'm on Twitter constantly because it is a fantastic resource for me to know what's going on, to know what scientists are talking about, to know where disinformation is and where good information is needed, and also to find sources. So it's been really a godsend, especially at the beginning of the pandemic when everybody was on lockdown and people were harder to reach. But even now, it's been really quite an amazing resource.
So we have a new president as of January 20th. And the person wants to know, has that affected the quality of information you receive from the federal government?
Yes and no. I think the quality of information has changed in that there aren't things that you read and go, what? This doesn't make any sense. Or there aren't things that you read and go, well, how much was this doctored? But that's only to a certain degree. I mean, yes, the administration is a lot different than the Trump administration, but it's still politics. It's still government. There is still obfuscation. There's still secrecy. I think anybody who was reporting prior to the Trump administration knows that the Obama administration was actually incredibly secretive, and the Biden administration is full of some of those same people. So they're not that open. I had a lot of conversations that were on background or off the record, with a lot of anonymous sources in the CDC and the FDA before the Trump, when the Trump administration was in power, and I still do. They're still not super open to talking to journalists. So that part has not changed.
No, it hasn't. I've had many freedom of information requests turned down by Obama, Democrats and Republicans.
Yep.
With most reporters now focused on COVID, are there still aspects of the pandemic that you think are being underreported?
Yes, I think we have not heard enough about racial disparities. I know there is some reporting, but there is not nearly enough. And I think the numbers, there's a lot of weirdness about the way they're collected. And I think there's not enough investigation into whether those numbers are accurate or how off they might be. There is not enough reporting on the sort of non-drug treatments. For example, there was a technique that's called proning that was used earlier on in the pandemic that doctors found very useful, and they're still using it. And apart from a couple of articles, one by Pam Belloc, who's one of my colleagues, and one by Roxanne Kamsi, I did not see a ton of coverage on that. So I think there are a lot of things that are not sexy that get left behind.
Okay. Are you hearing that current tests are able to detect the new variants, or do you think we will need new tests?
So far, the current tests do detect the new variants, so we have not really needed new tests. At least for PCR, that's true. With antigen tests, it's not quite certain because it's possible that some of the antigen tests may miss these variants that have what's known as the S dropout, where basically they're not picking up certain pieces of the spike protein, the outermost part of the virus. And so if that's the case, then those antigen tests might need to be redone or recalled. But the FDA is still looking into that and they're not sure.
Okay. So I know you did a story about pregnant women. Can you tell what the story was said?
Sure. So pregnant women are pretty routinely left out of research. They're left out of drug research, vaccine research, you name it. And the premise behind it is that because we don't know whether these things are safe, we are protecting pregnant women from this research. But in fact, what happens is because now we don't know how these things act in pregnant women, but pregnant women do need them. They need those drugs, they need those vaccines. We end up giving it to them with zero evidence of what they actually do. So there's been a push for quite a number of years to protect pregnant women through research rather than from research. That didn't happen with this vaccine. No one was really expecting that they would be included in the first rounds, but because these companies were not going for full approval, they didn't really need to do the kind of animal studies and reproductive and toxicity studies that they would have needed to do to get a full approval. They were just going for the emergency authorization, which you can get without these toxicity studies. So they didn't start those until later, and they didn't get them to the FDA until December. So we have pretty limited information overall about how these vaccines do in pregnant women. But given that absence of data, the CDC decided that we know vaccines are generally safe in pregnant women, and pregnant women are at high risk from COVID, and that risk is greater than any theoretical risk from vaccines. So they endorsed, and well, they didn't endorse the vaccine, and they didn't not recommend it. What they did was say that pregnant women should consult with their healthcare provider for their particular, risk, and do a sort of pro-con analysis, and then decide if they want to get the vaccine. On the basis of the very same data, the World Health Organization used wording like "do not recommend use at this time." And that was incredibly confusing to people because here are the two largest, most influential public health organizations in the world contradicting each other. The WHO didn't see it that way. They thought that they were saying the exact same thing as the CDC. This is a problem that has happened over and over during this pandemic, is the WHO thinks they're being super clear and they are being really not clear at all. So there was a lot of pushback and there was a lot of confusion. And then they did end up putting out another document where they didn't use that do not recommend language. And so I wrote about that. But the WHO was actually really angry because they thought that they were giving the exact same message in both places. So it's all kind of a weird policy issue, but ultimately all we need to know from it is that any pregnant woman who wants to get the vaccine can in the United States, as long as she discusses with a healthcare provider first, but there's probably very little reason to think that it would be unsafe.
Okay. Someone asked the basic question, is this pandemic going to end? Well, all
Yes.
pandemics end at a certain point.
The pandemic will certainly end. The virus will not go away, but the pandemic will end.
Yeah. Spanish flu took 4 years to end. What kind of data from independent research firms is most interesting to you? How do you decide which one to include in your stories or speak to experts?
What kind of data from independent research firms?
I don't know. I don't write the questions. I'm just reading.
It really depends on what the data is and what it's showing and
Okay.
whether I care about that issue. But
Okay. I guess there are a lot of think tanks doing their own thing.
Yeah, it really depends on the quality of the think tank. It depends on the quality of the
Okay.
report, the topic of the report. Commercial data firms are, I would say I am automatically more skeptical of them than of something that comes from an academic or nonprofit. But, it really depends on what the exact thing is.
Is there any evidence that people who previously had either the first SARS or MERS are less likely to contract or get sick from COVID-19?
We don't know, because SARS was pretty limited in one part of the world. And same with MERS, it was really just in the Middle East and in Korea, and in South Korea, they basically shut down their cases to a level where they didn't actually have a lot of people who had MERS, and then now we're going to have SARS too. So we don't know. There is some cross-reactivity between SARS-1 and 2. They're actually pretty similar viruses. So my guess would be that you would not prevent infection with the new coronavirus because it's different enough that you would still get infected, but probably some of those antibodies that recognize the new virus would at least mitigate the symptoms a little bit. So maybe it would be a little bit less severe.
So the clinical trials for the vaccines did not include people in nursing homes, yet they were slated to be among the first people to receive the vaccine. Is there a reason they were not included?
They were not included because they tend to have pretty low immune responses. They have ill health. And yeah, I think the companies just didn't want to go there, to be honest.
Okay.
So, yeah.
Okay. So your door is locked, so your children can't come in. So what do you think? So we can ask you, schools are going to be reopening in New York City at some point. Are you for sending kids to school?
Oh, you bet.
Oh, you bet. Okay.
I would like my kids to go back to school. My
Okay.
kids are at school 2 days a week when the school is not closed because it's in quarantine because they found 2 cases, which I think is a ridiculous rule. Yeah, I think we now have enough evidence to say that when schools take all the precautions, distancing, masks, hand hygiene, ventilation, open windows, that kind of thing, they can keep the transmission within the school very low. I'm not going to say zero, and that also depends very heavily on community transmission. If the virus is circulating at very high levels in the community, it's not going to work the same way. But I think overall, we've seen that schools can stay open, and I think the emphasis should absolutely be on schools should stay open as long as they can. I think the Biden administration has said schools should be the last to close and the first to open, and I would agree with that. The CDC has a new plan coming out on Friday that will actually help schools figure out how to stay open.
So someone asked, why is 2 cases at school a ridiculous rule?
Because when you have cases in the community, 2 people coming into a school with an infection is not very surprising. I mean, you would have to have community transmission be really low to not have,
Okay.
even 2 cases come into the school with, a positive result. So, yeah.
Okay. Have you had to deal with a lot of conspiracy theorists on social media? Do they attack you in your reporting? And how do you handle that?
Yes, I have had to deal with a lot of conspiracy theorists. A lot of the things that I write about are prime sort of fodder for them, like schools. There are a lot of people who have a lot of theories about schools and kids. There are a lot of people who have a lot of theories about immunity, which is the other thing that I write about, who are convinced that, we have all been protected because we have been exposed to the common cold coronaviruses. And so there's only a very small fraction of people who get sick because they just didn't happen to be exposed to those viruses. There are a lot of people who think that the death rates have been highly exaggerated, you name it. There's so many conspiracy theories. How do I deal with them? I try to offer information. I try to engage with most people as long as they're polite. But if it's very clear that they're really far down the conspiracy path and they're not going to even listen to reason, then I just stop and I ignore them. Mute is a fantastic Twitter button.
Okay. Yes, I had someone I know said last summer, I'm so glad that New York City has herd immunity. I said, we don't have herd immunity. He said, yes, we do. And he's an intelligent guy. And I know, nice guy. He said, yes, we do. He said, you don't know anything. I said, I think I know something. But it's amazing that people really think they know things and they don't always do it.
Yeah.
So here's a question about your work. Do you work on dozens of stories at a time, which you said you do? If so, how do you manage to focus your energies and make each one of them as good as possible?
Yeah, so I report on multiple stories at the same time. Like today I was reporting on 4 different ones, which is why my day was so intense. But I'm not necessarily writing them all at the same time, so when I actually am ready to write, I try not to have anything else to do for those 2 or 3 hours and really focus on just what I know about that particular story and try to center myself and work on that. But the reporting, I mean, it has to happen in parallel because I just don't have the luxury to, do them in sequence one after the other. So I just try to kind of keep a running list in my head of like who else I need to talk to for each story. And often that's at the end of the day that I end up sending, more interview requests because I can kind of have like a little bit of space in my head to think about what I haven't done and where the gaps are. And so I send out a whole bunch of interview requests, and then before I know it, the next day or the day after that is completely filled up with interviews again. So that's kind of how, I guess.
So what's been your biggest surprise in your reporting? Was there a story that just came out of nowhere that you didn't think would come out?
Variants again.
Okay.
Unfortunately, yeah. So the variants really took me by surprise. I was actually in Rhode Island when one of the first stories broke, and I ended up having to write it, even though I was on vacation. It was just too big a deal to ignore. And that really took me by surprise. And then a couple of weeks after that, I was writing an explainer about why we shouldn't be worried about vaccine not working against the variant. And then I filed it. I filed it on a Saturday, and my editor wasn't gonna look at it, till Monday. And so then I think it was actually MLK Junior weekend. So Monday, the holiday, the South African researchers presented data saying that about half of people who have recovered from COVID don't respond at all to the variant that was there. And that was just, it was like a stone dropping in my heart. And then I ended up contacting all the people I had talked to for that explainer, and they all walked their comments back. In fact, one of them had said to me something like, I don't think that this is, the idea of vaccines not working against the variants is something that the average person should lose sleep over. And after the South African results came out, I said to her, do you still think that? And she said, oh, did I say that? No, I wouldn't say that now. So that really shocked the hell out of me. And probably, I would say that's the most anxious I was about a story in terms of what it meant for the world, since the beginning of the pandemic.
So I was kind of intrigued by the stories on women voices and how women are just actually going out of their minds and screaming and, I know my daughter, just says, I just can't talk. Whenever I call her, she can't talk. And that's been, I think it was featured on CBS all week and Sunday morning and stuff. So do you think that story, but that story really didn't come out till this week? I mean, obviously, people know who are experiencing knew about it, but that's something that I think the mental health aspect of this is going to be huge. I've had 2 sessions devoted to coping with mental health and pandemics, but do you fear that there's going to be long-term mental health because children are not, playing with other people and just not growing up naturally? Parents are, high divorce rates or other things like that.
I think, I actually think that the kids will be fine because I think they're resilient. May not be true for all kids, may not be true for teenagers, especially older teenagers who are old enough to really process what's going on. But, I look at my 8-year-old, and yeah, she's 9. She just turned 9. She misses her friends. she misses going to school. She misses sort of playing with them. But, we still have play dates outside in the playground. And the other day she was wearing a mask in the house. And then she was wearing a mask in the car. And I was like, you don't have to do that. And she just didn't care. It's like natural to her now to wear a mask. So it just was not a big deal. So I think they are very adaptable. I would be more worried about adults. And I particularly worry more about older adults for whom, already they were lonely and probably not seeing enough people. And now this pandemic has really isolated them to a degree that's incredibly unhealthy and dangerous. I've talked to doctors who talk about, older people coming in with what's called, failure to thrive, where they're just not eating, not drinking, not taking care of themselves because they've just kind of lost their connection to society. And I think that and women, especially single mothers and other people who are trying to make it work and having a really tough time, I think that's where I would really worry about long-term consequences.
Okay. So is there anything you've learned covering the pandemic that you would love to have told yourself as a younger journalist? If you could speak to your younger self.
I would say that, I guess I'm not sure, exactly which perspective to answer that question from, but one thing I would say is what I was saying at the beginning, which is like the science journalist time will come. If I were, I'm sure we've all been through this as science journalists where you feel like, you're a second-class journalist because it's always about politics or something else that's really much more important. I would say, keep doing what you're doing because this matters and this will matter even more down the line. So I guess that's one way to answer that question.
Someone asked on Facebook, if you could tell your younger self something, what would you tell them? I said, buy a lot of toilet paper because you're going to need it. Okay. Do you feel that the scientific community has more confidence or less in what lies ahead for the next 6 months?
I think they have a lot of confidence, actually. I think that, like I said, the variants are something that have thrown people for a loop, but overall, I think this has been a triumph for science in many ways. I mean, to go from a brand new virus that we knew absolutely nothing about to now knowing how it's transmitted, how to treat it in many different ways, and to have a vaccine, most of all, which normally would take years and years. I think that this has been really quite a triumph for science. I think if we've had as many deaths as we've had, it's more because of political failures than scientific failures. So I do think that scientists feel like they are united. And there's a lot of collaboration now among scientists who probably didn't even know each other before. I know of a lot of WhatsApp groups and support groups for scientists who, have these private chats where they can talk to each other. A lot of women especially have connected with each other during this pandemic. So I do think that there is a sense of sort of, we're all united in this fight against this enemy, and I think they are inspired to fight.
Well, I know I've been in touch with a lot of science journalists around the world, and I think that's been a very good thing for science journalists. And on the show, we've had groups we're trying to get a group from Asia together, but time differences aren't so easy. But we've done European journalists. I did one with a journalist from Sweden. I also did Latin American journalists, and many of them are people I've met in trips, different conferences around the world. So that's been rewarding. So here's a question. What is your educational background? You have advanced degrees in science and or journalism. Do you think it's important for science journalists to have studied science in school?
I do have advanced degrees in science and in journalism. I went to grad school for biochemistry. And like a lot of science journalists, I thought I wanted to be a scientist and decided that wasn't really for me. And then I went to NYU. I went to a science journalism program at New York University. So I have masters in both of those things. But what I'm writing about now has nothing to do with biochemistry. So I've known really fantastic science writers who have no science background at all. And I've known really fantastic science writers who are PhDs, and I've known really bad science writers in both of those camps. So I'm not sure that any particular background is any better than the others. I will say, being familiar with the business of science, sort of how scientists think, the competitive nature of it, the iterative nature of it, the reward system, tenure, publication, all of that, I think is helpful just to know the context in which science is conducted. But, I have colleagues who are now reporting on this pandemic, not so much in the US, but European ones especially. Like I have a colleague, Ben Muller, who's our correspondent in the UK, who is not a science journalist and has been writing amazing stories about the variant and the AstraZeneca vaccine and all kinds of things. And he's able to do that because he's just a really smart guy and asks good questions. So I don't think you need a science background.
When people ask me, how can I write about medicine or science and not be a doctor? I say, people write about politics who are not politicians. People write about sports who are not athletes. You want a good writer. You want someone who can tell a good story.
Yeah.
So what is your sense of how well the public understands what a virus is, and coronavirus in particular? Do you think the scientific, and do you think the scientific literacy of the public has increased significantly?
I do. I think it has increased significantly. I wouldn't say that everybody now knows what a virus is or understands the difference between a virus and a bacterium or anything like that. But I do think that overall, the scientific literacy has gone up. I think that a lot more people now know the word antibody, even if they couldn't tell you exactly what it is. I think there are a lot more people who have gained a sort of working knowledge of immunity and vaccines and viruses and infections and quarantine and all kinds of things. So yeah, I think that it's forced a lot of people to learn some concepts.
So I'm getting a vaccine tomorrow, and someone said, don't take Tylenol before you take it. Don't take Motrin, don't take Advil, which I knew about, but it's interesting that people are paying attention. So when the urgency of the pandemic eases, how can we help frontline healthcare workers recover from the stress they have endured? That's a good question.
That is a very important question. I think, you were asking about mental health crisis. I think the healthcare workers are among the people who are going to really need a lot of help recovering. I'm not sure how we help them. I think they also feel betrayed by their hospitals. I think they feel betrayed by the government because they were being told for such a long time that they didn't need protective equipment. And I think during this, the hospitals have had all these really draconian rules about who can talk to the press and what they can say. And there's a lot of trust that's been lost. And I think a lot of them are just in war mode, just continuing to work beyond their capacity. But that's going to take a toll long term, and I'm not sure how many will stick around, how many will have long-term permanent damage from having been through this situation. I think I'm not sure what the solution is to helping them beyond us all being aware and the systems, the institutions, giving those people the opportunity to get help, counseling and time off and all of the things that they might need to recover.
Okay, so someone asked a question, which obviously you can't answer. Do you have information from off-the-record conversations with scientists and government officials that you think the public should know about?
Sure, all the time, but they're off the record, so I'm not going to talk about it.
Okay, so what do you know that we don't know?
Can't tell you.
Okay, you can't tell us, okay. So we're getting close to the end. So I like to ask people that I interview what they do. So we know you have not done indoor dining and don't plan to. Have you gone to a museum?
Nope.
Okay, I have. I think they're okay. Paul Offit told me I could go.
I
Have you
haven't
taken-
not gone to a museum because I think they're necessarily dangerous. I just haven't gone because I don't have the time.
You have children. Yeah, I never did any, I tell people when you have young children, you used to be an intellectual and read. Now you don't. I'd also like to ask you, have you taken a subway? Do you take public transportation?
I have not because our office is closed.
Okay.
So, I mean, it's not closed, actually. You could go. It's open. You can go to the time office if you want, but I have not. Because most of my colleagues aren't going either. So why would I? So no, I have not taken this. I think I took it once, but I have not really taken it very much. I mean, I can make this easy for you and just say I've done almost nothing. I
Okay.
don't do very much at all. I've eaten
Okay.
outside in none of those igloo type situations, but really outside. And I go on a lot of walks with friends and colleagues. That's my socializing.
And how'd you get to Rhode Island?
We drove. My
Okay.
in-laws live there, so my husband drove.
Okay. Okay, so next week I'll be interviewing, it's gonna be on the next Thursday. It's gonna be 10 in the morning because it's an incredible researcher. How do you pronounce her last name? Sivak?
Evic.
Sevick, okay. And she's in Scotland. And she's very, very busy. I'm going to be interviewing Catherine Eben who wrote the book, The Bottle of Lies, and we're going to talk about the FDA's response to the pandemic. Carl Zimmer has a new book coming out in March, and I'm going to speak to him. And Sherry Turkle has a new book out. So I hope you'll look for the announcements. And I want to thank you for taking time out of your busy schedule. I really felt bad that you had to eat dinner 2 minutes before you spoke to me. So I want to thank you, and it's great having you. We got a great turnout, and just keep up the good work. Stay safe, and I hope you get a vaccine very, very soon.
Thank you.
Okay.
Thank you. Thanks for having me. It's a pleasure.
It's been a pleasure. Okay, take care. Bye-bye. See you on Twitter.